The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanic, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Hi, everyone. It is Tuesday morning, and we are gathered here for the next episode of TMD Demystified. I am Tony Urbanic. Today's episode is entitled TMD and Apathy. TMD and Apathy. This may be one of the shorter episodes that I produce, but it is definitely not unimportant. It's very important. Frankly, extremely important. And this is the reason that I currently see huge amounts of apathy associated with this problem, that we call TMD/TMJ. It depends on who you ask, how the apathy plays out, whether you ask a patient or whether you ask a doctor about apathy and its relationship to TMD. You will get different answers, quite different answers. But neither one of those sets of answers is encouraging. Since the inception of this problem being developed, problem's always been there. I think it's increasing significantly in modern times. I think it's increasing very significantly in our modern world because of increasing amount of anxiety and stress in our modern, quote, modern, whatever that means, world. I don't want to get historical about this, but I think that stress has always been with mankind. And in earlier centuries, the stresses were quite different in the Revolutionary War, in the Civil War, in the Second World War. But modern culture is like a nonstop set of stressors, which are cultural, political, economic, educational stressors that we have not dealt with in centuries past. Admittedly, century past stressors have been maybe just as serious or more serious as you tried to survive under very difficult circumstances. But the amount of bruxism and the amount of stress that people happen to people now, I think is extreme. And because of this problem called TMD is being seen much more often. I did not observe it personally during COVID, but I have had many of my dental colleagues say that they saw much more temporomandibular joint complaints, TMD, TMJ, during the episodes of COVID. So the problem is getting worse, and both the doctors and the patients are getting more apathetic about this problem and have been more apathetic. And it is my job, my purpose, to teach and develop and encourage listeners, observers, participants to understand that this problem is not that complicated. I know that everyone, and I mean everyone, the universities, the dental schools, the doctors who claim to be TMD guru specialists who do half-day workups on the TMD want to make this problem complicated, but it's not complicated. And my purpose is to make it uncomplicated and to delimit limit the amount of stress created by the problem, and to certainly get away from the apathy regarding this problem that is developed by both doctors and patients. So break this into two subsets. You got the patients themselves, and I'm well familiar with the patient's apathy to this problem. We see it in this practice, and I hear about it from the other practices that are network providers, that, patients, many patients who have this problem for 10 years, 20 years, 30 years, have given up to one degree or another, hoping that there is a solution to these different kinds of symptoms that they deal with almost on a daily basis, that doesn't make any sense to them, that doesn't make any sense to their PCP, that the oral surgeon doesn't know what to do about it, the general dentist tries a night guard and doesn't work. And it goes on for years, for decades, and they become apathetic about the problem and lose hope that there is any solution. And it comes across various ways when patients enter our practice. Some of them say, I hear that you have a solution to this. You are my last hope. You are my last hope. I've seen, and I don't exaggerate these numbers sometimes, 5 doctors, 10 doctors. I had one patient said that over a period of 20 years, she had seen 150 doctors. And I questioned her about it. She swore that over 20 years, she had seen 150 different doctors trying to figure out and help her with these symptoms. And they become very apathetic about the problem and they give up. And then when they become apathetic about it, not only do they lose hope, but they lose any opportunity. They just throw up their hands and don't seek any further treatment. And then sometimes they will get enough encouragement from their general dentist and said, I heard that there is a practice in Brentwood, Tennessee that has a solution to this, or I received a promotional piece from this practice in Brentwood, Tennessee that defines the problem and encourages patients to come in. And so we see a great number of patients who have given up hope. I actually have 3 documented patients who have, without encouragement from me, just in talking with them, have told me that they have contemplated suicide because of never-ending pain. Fortunately, none of them had followed up on that suicidal ideation, but I have one woman who actually, once we got her symptoms at bay, and for several months, and we asked her to do a video, and we actually have her on video talking about her success and how her symptoms were down, and the fact that she had seriously contemplated suicide. Now that's absolute apathy. And in some case, fortunately, they're not that many. I mean, 3 out of 4,000 patients, that's not a high probability, but it's enough to sober the practitioner, the medical dental provider, sober. It's a sobering thought that you're dealing with something that are so severe in the patient's mental health that they consider suicide, and something that is, I say it honestly, easy to fix. It's not difficult when you understand the problem, the misunderstoods about what the problem is, the misunderstoods about there is no such thing as myofascial pain dysfunction syndrome. The myofascial part of this does not exist. Muscles do get tight. Muscles get tight generated by autonomic signals from the nervous system telling them to get tight, but it isn't generated by overuse of the muscle. It's inflammation in the joint. Anyway, that's the basics of it. I talked about it so many times, but getting back to the apathy, the benefits for a patient go far beyond getting rid of their symptoms when they have reached the point of mental health apathy. when you do, you don't have to go very far into this. You don't have to see many patients when you begin to observe that when you treat a patient with, have to say, the Urbanic device and protocol, have to say it, and you come in to the examining room 6 weeks later, 2 months later, 3 weeks later, after delivery of the device, and there is a different person sitting in the chair. I mean, the face is the same, but what you're looking at, I mean, you can see that it's a different person sitting there. Their emotional tone is highly raised above what it was when you began treating the patient. That's an indicator of their mental health, their emotional tone. Their mental health just skyrockets when their chronic pain goes away, and they now have hope that they don't have to live for the rest of their life with headaches, earaches, jaw pain, neck pain, ringing in the ears, or all of those combined. It is, on top of that, a tremendous practice builder. When you bring somebody up tone and their mental health improves, they are so grateful and they want you to be their primary dental provider. We hear it all the time. There's so many benefits to doing this and bringing the patients out of apathy. So, and not all patients are apathetic. I saw a young woman today, she only had the problem for 3 years. She was only 32 years old. And her claim was, I've really only had this jaw pain for 3 years. So she had not had the opportunity to be so apathetic. She had already seen multiple doctors trying to solve the problem in different ways, different treatment modalities, which were not effective. But the point being, younger people who only have it for a shorter amount of time do not develop that apathetic continence. But the apathetic patients are actually I believe, it's definitely increasing in numbers and close to being in the majority. They lose hope because they've had it for 10 years, 20 years. I hear so often, I figured out I was just going to have to live with these symptoms for the rest of my life. I've heard that so many times. And then when you make the symptoms go away, you are their best buddy. You are the best, I've had, people say, I talk about this, I talk about you, I talk about this practice to everybody. It's huge, a huge practice builder, a huge PR improvement. And it is such an easy thing to do when you understand the problem correctly and you understand the proper solution. Now let's go to the doctor's apathy on this, because I respect all of my colleagues, and I mean all of them. We all had to go through this process to become a dentist or oral surgeon or orthodontist. Anyone who actually went through that process, I respect them highly because I know what they had to go through. On the other hand, in regard to treating TMD, the vast majority of the dental profession is absolutely apathetic about treatment because they know nothing works. And I could go on for hours quoting my dental colleagues and what I have been told over the years of why they're apathetic. They don't use the word, they seem apathetic. They don't want to treat it. They don't want even to hear about it. They don't want the patients with this problem to come in their office. And so half the dentists send the patients away untreated and say, either I don't do that, or half the dentists make a night guard and give it to the patient, knowing that it is not going to be effective, and send the patient away, hoping they don't come back. And then there are the few gurus out there who use overly complicated, overly non-effective treatments, trying this, trying that, and then trying to game the insurance companies to pay for it. I mean, I said that before and I stick by it. We all know that goes on. Don't like to see it because it's a black eye to our profession when that goes on. If you're doing something that's not effective, eventually it's going to come back on you one way or the other. So But the apathy that the doctors portray with this problem is pandemic, literally. And, I've heard, most recently, I quoted a very good friend of mine who wants to do this. And his quote was, "I don't want to get married to the patients, though," inferring that what he will be doing will not work and the patient will keep coming back and coming back and coming back. Well, that doesn't happen around here. Our problem here is getting the patients back to the end of the protocol, because once they figure they're fixed, they're not want to go back to the doctor. "I'm done, I'm fixed." So our biggest problem is getting the patients back so we can document their improvement. And we get plenty of those back, but we also lose a lot of patients early on. Sometimes they don't, once we deliver the device, we never see them back. And we call them up and, "Please come back." "No, no, I'm fixed. I don't need to come back." We hear that constantly. So that bigger problem is not getting them back. They won't come back, not marrying the patient. So there is no need to be apathetic about this, and more importantly, in my experience over the past 14 years of doing this, is that I am increasingly becoming aware, mainly because of my journeys on the internet, listening about burnout, professional burnout in the dental profession. In my case, as an oral maxillofacial surgeon, I've enjoyed my career tremendously. I had the opportunity to be on the cutting edge of orthognathic surgery, microneural surgery, cancer reconstruction, dental implants, very cutting edge of dental implants. And I certainly was on the cutting edge of temporomandibular joint surgery and did it for 36 years until I said I can't do it anymore. The results are just not good enough. And that's when I quit. But I had the opportunity, because I was an oral maxillofacial surgery, to absolutely enjoy my career. Cleft palates. I did so many cleft palates on kids. It was great, great service. But not all doctors and dentists feel the same way about their career, and they get burned out. And I'm hearing about it more and more, especially from younger doctors. I mean, we're not talking about doctors who've been doing it for 30 years. I'm talking about doctors who've been doing it for 5 years, 7 years, 10 years, and they're already talking about being burned out about their profession that they spent 4 to 8 years learning how to do correctly. And that's a shame. And so the point being, they become apathetic because of their stated, I understand why, and I understand the problems with both physical and mental and emotional problems doing our profession. I certainly understand those, and they're not made up. But again, treating temporomandibular joint patients is the opposite of burnout. It's something that the patient is extremely appreciative for. You are not bent over the patient and ending up with neck and back pains and wrist problems. It doesn't take long to take a patient through the protocol. Literally start to finish, depending on how much you can get the patient back, anywhere between 30 and 45 minutes, all inclusive. Consultation, delivery, a few follow-ups at best. There are exceptions. Some people come back, they take a little extra time, but they're not in the majority at all. And again, being that they're so appreciative, and they send their family in to see you, and want you to be their dentist. I had so many people want me to be their general dentist. I had to verify, clarify that they didn't want me to be their general dentist. I hadn't held a high-speed dental drill in 40 years, 45 years. But but doing this service for patients is an anti-burnout patient service. And whether you do it like we do here solely as the only service we do in this practice is non-surgical TMD, or whether most of our network providers certainly don't do it solely, both oral surgeons and general dentists and orthodontists, just added as a service to their practice, but it adds to the color of their practice, the ease of their practice. It adds to their satisfaction with their practice, both emotionally and medically and mentally and economically. A huge benefit. And when you do that, you become less apathetic about TMD. In fact, you shouldn't be apathetic about it at all. The apathetic goes away. So with that being said, apathy actually is very common in both patient and doctor regarding TMD. And there's no reason it should be that way. It has actually more than surprised me, blown my mind when I began to do the investigation and uncovered in the literature the actual answers, the actual pathophysiology of this problem. It blew my mind is why this has not been discussed, has not been taught, it has not been investigated, it has not been confirmed prior to me going into this and looking this over. It blew my mind why it took so long, why this problem knew it was a big problem, and why it just didn't have a reasonable, successful, predictable solution for decades. When actually the parameters of and description of the problem applied correctly was well known by the orthopedic surgeons as it applied to the other joints of the body. That's why tennis elbow and TMD are the same disease, different joints. And the orthopedic doctors, orthopedic surgeons knew all about this as it applied to the elbow, tennis elbow, or the hip, or the knee, but especially the tennis elbow. It's so similar. The tennis elbow causes pain in the forearm, but it wasn't shared with the dental establishment. And why it took so long for someone to connect the dots here. It blew my mind. So there's no reason for apathy here. The patients should not be apathy. The dentist, healthcare providers should not be apathetic about it. We need to get away. We need to definitely do away with this concept. When it comes to TMD, nothing works. And that is the consensus out there. And the problem then is not that there is a solution. The problem is dissemination of the solution. And I ask you in a very sincere form, if you are listening to this so far, to consider taking me up. Challenge me on what I teach. Challenge me on what I have to show. Challenge me on the statistics of it. Challenge me on the study. Challenge me on the number of patients that have been successfully treated, because all of that can be proved. And so if you have stuck with this particular episode this far, I encourage you to lose your apathy regarding temporomandibular joint treatment. There is no need for it. And the patients should not be apathetic about it, because there is a solution for it. And the fact that there are patients, millions of patients out there who believe that nothing works, and they come in literally with a brown paper bag with a half a dozen night guards in it, or they have been seen by all kinds of providers doing what those providers do in their own way, whether it be dry needling or chiropractic or drugs from the PCP. That's what they have to offer, but we all know that those are not effective. They are not successful. So the dissemination of this is really the only stop and barrier that we have in doing away with the apathy from both the patients and the doctors and the healthcare providers of all varieties about TMD, TMJ. I ask for your help. If you'd like to help, if you'd like to learn more, if you'd like to become a network provider, if you want to just question me or challenge, that's fine, or criticize, that's fine too. I can be reached at Tony@tmjservices.net. That is TONY at tmjservices.net. Our website is www.urbanictmj.com. And on that website is all kinds of materials that can be reviewed, hundreds of success stories, access to our university independent study validating our claims, and a whole lot more. You can register for our on-site in-person seminar. You can register to become a network provider and learn about this and actually become a network provider, taking our online 3-hour course, which gives 3 hours of CME. And by the way, our in-person course, which is scheduled for July 26, 2024, offering 6 CME. And after that, you're qualified to use the Urbanic device and protocol. It's not complicated. It's very simple. And with proper development of dissemination processes, this problem can be slayed, done away with. Until next Tuesday, I invite you to get interested in treating this problem. I invite you to look forward to the next time I have the opportunity to speak on this problem, on this podcast, in an episode called TMD Demystified. I am Tony Urbanic.